from that time with the pandemic in March of 2020, and then how we took care of cancer patients was just drastically changed from things like looking at, did we even have enough PPEs to do operations? Did we have to save PPEs for treating patients with COVID and things like that? So because of that, and how drastically we changed our management of cancer patients in the early days, and then all of the variants and the surges and things like that, and how the pandemic really changed our approach to healthcare in general, but cancer patients specifically, everybody sort of knew kind of in the back of their minds in the cancer world that probably screening stopped. We're going to have patients coming in with later stages, and we just weren't doing things normally, but we didn't really have any evidence of that. Sort of as the years came along, there were reports that came out of, what was actually happening, people's institutional experiences, some other registries, but really because the NCDB is, really the foremost cancer registry in the country, if not the world. I mean, we really hadn't looked at that. The main finding is that the year 2020, about 200,000 cases are missing, newly diagnosed cancer cases, which represents about 14% decrease in the number of cases that you would normally expect. And NCDB data historically is very, very stable. Like there's very, very little year-to-year variation overall. And then in the year 2020, it just plummeted by over 14% of cases. They were just not, they were not diagnosed or treated in these cancer programs, these COC accredited cancer programs. In addition to that, what we could see on the inside, which programs won't see when they look at the data because they don't have as granular data, but we could see the timeliness, the month-by-month variation in the year 2020, which is what you kind of expected, which is January, February, okay, March, when the stay-at-home orders started, when the pandemic was declared, there was a drop in cancer cases, newly diagnosed cancer cases coming in for diagnosis and treatment, bottomed out in April, slowly came back up to May, almost to normal levels, but there was no rebound. Like we didn't catch up. We never caught up those missing cases. So I think, fundamentally, we're sort of waiting for the next, like, where are those cases? Are they coming in at later stages? What happened to those?
This is a global look as like a GPS system, tells you kind of where you are across the globe, so that when you deep dive into the specifics of a cancer, you're not thinking that you can create context around it. So to Dr. Lum's point, it was supposed to serve as a point of reference and context, rather than diving into specific hypotheses, because each hypothesis is different, right? I mean, each disease is going to have its own series of hypotheses. I mean, if there's one thing we know, cancer is not one disease. Cancer is so many diseases in so many different ways across the board. We just can't globally comment on cancer as one thing.